was younger, like in medical school, I had a bike, and one of my friends and I would go on bike rides, maybe 10 or 15 miles at the most. And then I got married, started a career, started a family. I really didn't bike at all. 2013, I started noticing, especially when I picked up something heavy or when I tried to run, I was getting pain shooting down the back of my legs.
Dan and I were actually co-residents at Shock Trauma. So we trained together in early 1990s. Before, he had about 7 millimeter spondylolisthesis, which moved with the flexion extension.
As an anesthesiologist, I have to push patients around on stretchers. If I couldn't do that without pain, then that significantly restricted what I could do at work.
One thing good about this procedure is actually when you put the cage in and you expand the disc space, it actually reduce the spondylolisthesis. So in general, because we are actually, really muscle and bone and ligaments and vascular anatomy sparing procedure, the patient has pretty rapid recovery.
I was back at work in 3 weeks. That summer, I felt good enough that I started training for a Century bike ride.
One time, I remember, pretty soon after we did surgery, maybe 3-4 week surgery, he came to my operating room and sort of sheepily smiling and asking me, "Charlie, guess what I did?" I said, "What?" He goes, "I went on a bike road for like 100 miles last week." I said, "You did what?"
We've been doing that bike ride every year since. Dr. Park is an excellent surgeon. I've known him for a long time. He takes excellent care of his patients. He truly cares about his patients. Without this surgery, no, I don't think I would have tried to do a Century bike ride.